Hello, I'm Dr. Karl Kabasele, and I'm a public health physician. My career has been pretty unorthodox. I started out as an associate medical officer of health for the city of Toronto during the time of West Nile virus, SARS, bioterrorism was the thing. This was in the year 2001. I was the lead physician for the West Nile virus program for the city of Toronto, and we basically had to come up with a program, a way to control this new emerging virus from scratch. We learned a lot during that period, those of us who came out of our residency around that time in 2001, and it was an excellent experience. And then in 2004, because of the work I had done as a spokesperson for the City of Toronto in the West Nile virus program, one of our local TV news stations asked me, might I like to be the medical expert or the medical correspondent for their 6 o'clock news? And I thought about it and I said, yes, I actually would like to do that. And that began my media career at that point. I also went back into clinical medicine. So after 3 years of being an associate medical officer of health, just doing public health, I got a job at the Center for Addiction and Mental Health, which I still have, on the addiction side, helping people to quit smoking. So that's sort of my clinical practice at this point. Over the years, I had the chance to work for local news, City TV and CP24 in Toronto. I had a chance to work nationally on the CBC as well. So it has been a very interesting career, and I'm still doing media, although on a different scale, different platform. Myself and my colleague, Dr. Onyi Norum, have a podcast called Race, Health, and Happiness. And that has been my, creative outlet, and my public education through media has been on the podcasting side of things. Now, more recently, I've gone back into more traditional public health practice. So I spent a year at Public Health Ontario, working with the environmental health program. And I also did some communicable disease with Public Health Ontario as well. And then came the year 2020, and with it, of course, came COVID. And that presented a new opportunity for me to work, again, sort of coming full circle back to local frontline public health. And I now work for York Region Public Health, doing consultation on COVID and some other communicable disease issues that come up for York Region. So along this journey that I've had over the 20 years of my career, I've really followed what interested me and what I wanted to do. So how would I say that the PHPM program at the University of Toronto helped me to prepare for my career? Well, I think maybe the greatest strength of the program was the flexibility. It really allowed me to pursue my interests. It allowed me academically to do the kind of study that I wanted. So one of the requirements was to get a graduate degree if you don't already have one. And it, the program was flexible enough to allow me to go to Harvard to do my MPH there, which is a goal that I'd had as a medical student. And I was able to do that within the context of the program. But the other strength, of course, is that, you learn clinical medicine in medical school. If you're lucky, you do get some public health exposure as well. But in my day, there was very little of that exposure. So I think what the residency did for me was to expose me to a different way of thinking. Instead of sort of that individual Western medicine dealing with problems way of thinking, it allowed more latitude and creativity to perhaps prevent disease or, think upstream of disease in such a way that hopefully you can affect it before it even starts. You could prevent it before it even starts. And it really did help me to build the skills that I wanted and needed for the kind of career that I imagined I was going to have. Now, of course, life took me in all kinds of directions, but having that strong foundation from the PHPM program at U of T helped to support all of the various decisions and frankly opened up doors and possibilities in terms of the things that I could do. So, if you have a sense that public health is in your future, I think that the PHPM program at U of T is an ideal place to start that career. And by the way, I'm happy to talk to any one of you who wants to have a one-on-one conversation where I can tell you more about what I've done or talk to you about some of your ideas for your career. I'd be happy to do that. You could reach me at the email that you see on the screen, and be happy to set up a one-on-one. So to all of you, I wish you good luck, and it was really nice to talk with you. Thanks. I really do mean it. Please do get in touch. I'll be happy to talk with you. All right, so long.